Are you looking to optimize your health? Are you looking to get the best supplements at the lowest price? For high quality supplements and to talk to someone about what supplements are best for you, go to takeyoursupplements.com and one of our fantastic true health coaches will help you pick out the right supplements for you that are the highest quality and the best price. That's takeyoursupplements.com. takeyoursupplements.com. That's takeyoursupplements.com. Be sure to ask about free shipping and our awesome referral program. Welcome to the Learn True Health podcast. I'm your host, Ashley James. This is episode 170. I am so excited for today's interview. We have with us our first dentist, right? It's all about teeth today. And not only that, there's a huge correlation between our oral hygiene and our physical health. There's such a huge correlation between our diet, our nutrition, and our teeth. It's kind of like the teeth can be like the smoke if there's a fire going on, right? If we have bad oral health, we can point to so many things in the body. And I am so thrilled to have with us Dr. Lin, who's going to show us how we can have stronger, healthier teeth. We don't need to just wait until they rot and then get them replaced. That doesn't help at all. That just means that the body is rotting up from the inside, because the teeth is this example of the surface health. It's a mirror to show us what we can see inside, to see what's going on inside. And so I'm so thrilled to have you here, Dr. Lin, to share with us what we can do, not only to be cosmetically beautiful, have a beautiful smile, but to make sure that we have the healthy body overall.
Oh, hey, Ashley, it's such a pleasure to be with you today, and I love that analogy that the mouth is the smoke. And it really is. We really can detect what's happening in our body much quickly with our oral health. Before they become problems. Further down the road. So I'm excited to talk to you about that.
Wonderful. And so many countries, we don't have dentists paid for like by state medicine or by, we have to pay for our own dental health. Most people have to pay out of pocket. A lot of people don't even have dental or oral health covered in their insurance, especially if they buy their own insurance. People often opt out because it just doesn't fit into their budget. And so many people aren't seeking a dentist on a regular basis. And I know that they would love to learn from you because they want to do as much as that they can to prevent things going wrong down the road, so that they don't have to pay that costly bill. But what's more important than money is our own health, because what does money matter when we don't have our health? I'd love for you to start by sharing your story. What led you to become this wonderful holistic dentist that you are today?
Yes, it's really interesting. You say that it's quite a a significant partition we've made in society between our oral health and our overall health, and it is partly economical because the way we don't see it as as a necessity to our healthcare system. So it really is something that we've unfortunately segmented outside. What we see as being, we budget, but it's also unfortunately what we see. We don't see the mouth as a part of the body, and it really is. And so that's something we need to change. And so, I was practicing dentistry for a long time, and I found it a very rewarding career. It's a very difficult training process, and then when you get into the clinical setting, it's very challenging. Fixing things in the mouth is hard. It's a very sensitive, wet place. Teeth, you're building things that have to, withstand hundreds of pounds of force, over many years of a person's lifetime. It's a very hard and rewarding job. But over time, I began to notice a pattern in my work and my patients, in that I was seeing disease and I was fixing it, but I didn't have the answers as to why they were happening. And it began to bother me. I would see people with, with rotten and crooked teeth in their childhood, and they would grow up to be adults who are sick with with gum disease, and eventually perhaps lose their dentition. And there was a pattern. These people were sick overall, and I think I was seeing something in their mouth that I didn't have an answer for, and I could fix them. But the conventional ways we were taught to prevent disease, such as brushing, flossing, and fluoride, for instance, weren't giving the answers, weren't getting to the real root cause of the problem. And so that was something that really began to play on my mind. And um, I it became so bothering for me because the real thing about dental disease is we are in the middle of a dental disease epidemic, and we have the mindset that we just go and get our teeth fixed, whether it's a filling, braces, or we have our gums treated, but we're really not addressing we're in the midst of a dental disease epidemic. And so it was it's many years ago now, but I took a little bit of time off work because I wanted to kind of reprogram where I was at. I thought that perhaps the work that I was doing wasn't quite as fulfilling as it could be, and I actually stumbled across a book by a dentist called Weston A. Price, and he wrote a book in the 30s called Nutrition and Physical Degeneration, and it was a very eye-opening moment for me because he talked about the mouth in a way that my training, the 7 years of dental training, biomedical science training background, that I had never really considered before. And so I saw this book, and my first reaction was that I didn't understand it. And so it was a story about a dentist who traveled the world in the 30s looking for the difference between the modern traditional diets. And he had a theory that the modern diet had caused the dental disease epidemic he was seeing in Cleveland, Ohio. And he was Canadian, by the way. So you guys are always thinking ahead of the curve, right?
Smart Canadian.
Yeah, that's right. But so what Price was talking about, it really, whilst I understood from because I was obviously trained as a dentist, it didn't fit into my normal paradigm of how I would look at a person's mouth and their dental care. And so he was taking full face photos, took thousands of photos. He took food samples. He looked at anthropologically back through the skull histories, because our human history is made with jaws and teeth. What we know about our human race is very much embedded in giving our ancestors a dental checkup. And so what Price kind of alluded here is that the disease we see in the mouth is a very, very recent phenomena, and that we've more or less, on the scale, if a scale was a mile long, it would the the time that we've seen dental disease is the very, very last fingernail on that scale. It's very alarming in terms of what we're seeing in our children's and our own mouths. And so that was a new perspective for me. And he even brought into the paradigm of malocclusion or crooked teeth being caused by diet. And that was something I'd never even considered. I would look at crooked teeth in kids, and we would classify it, and we would send them off to the orthodontist to be treatment planned for braces, and we would sometimes we would work alongside, and that would be that. We would straighten the teeth, and there was no other questions asked. There was no etiological explanation for why crooked teeth occur. And so I began to research this. I began to look at the background of what he was talking about nutritionally. I began to look at all the science that had actually plugged in the meantime. And there was a huge story here. And what I found was that Price's work had been largely misunderstood. And it also is that we have a body of evidence now that's popped up in the last 10 to 15 years that is very much confirming what he was saying. And there's a huge problem in that nutritional guidelines have not really considered teeth. And this is what Price was saying, is that if you eat for the mouth, then the whole body falls into place. And it makes complete sense when when that kind of thought process came to me, but I had never really thought about that. I'd never really shaped my diet so that, or the diet of my patients, so that I would eat for oral health, and then the body falls into place. And I think we've really kind of gone down the road of trying to really, you know, all the complex things that happen in the body after, and like weight gain and metabolic problems and all of this, and we try and shape our diets for to have a healthy body. It really does has stopped us from thinking about what our body really needs, and our teeth, give us a clear example of that. And so this is the amazing perspective that opened up for me, and I went back to a lot of my nutritional grounding in my biomedical science background, and I began to really kind of plug in what we know from a dental health perspective. And there is a very specific way that we should be telling people to eat for their teeth, and this really can be applied clinically in the practice where I began to practice with my patients, and really break down why these diseases were happening, what were the ramifications, for instance, of crooked teeth where the jaw is not growing. So the core problem with why kids aren't growing straight teeth is that our jaws aren't growing, and so that's a bone.
Mm.
And so this is a huge paradigm. There's a whole world of functional dentistry now where we can correct a kid's posture and function, so we get them to breathe through their nose with closed lips, with the right tongue posture, and their teeth begin to straighten naturally because their jaws begin to grow. And the problem there is that we don't have the right um, the right bone building factors that are pushing that to start with. So our bones are growing improperly in the first place, and then we're building poor function around it. So we're breathing the wrong way. We're not using our tongues the right way, and that's why um, we have this epidemic of crooked teeth or malocclusion. And this is I think it's one of the biggest problems facing the human race. Our skeletal system is not growing properly, and the problems in kids flow on to many chronic issues when we don't have the when our jaws don't grow correctly, we don't breathe right, and so we're now probably facing one of the biggest chronic disease uh, problems is sleep apnea and breathing. And so, and the core issue is that we don't have the skeletal structure to support our airways. And so, we kind of see sleep apnea as this um, overweight male that snores and needs a CPAP machine. That's the end stage of the disease paradigm. But in my practice, when you see a child, for instance, between 4 and 10 who comes in with a long face, their mouth is open, their tongue is hanging out, they've got dark circles around their eyes. These are kids that aren't breathing right through the day, and they're also not breathing right at night. And that means their brain is starving of oxygen when they're sleeping, and it's starving them of the most crucial developmental stages. And so this is the flow-on effect of our jaws not growing right. And that goes right through to people that have had braces and that haven't had their airways assessed. When we just straighten the teeth, the teeth are just a symptom. The
Mm-hmm.
jaws, the facial muscles, the tongue, nasal, the way we breathe are all the basically shaping how the teeth come in. And that's just the last touch. That's our body going, right, okay, this is the space we've got. Here's your smile. And so all of these things, there's a great new field of functional dentistry that can get into this. But really, the core problem is that we need to eat so that all these things basically sort themselves out. So that was basically my kind of road in, and it's really where it's I've written a book called The Dental Diet that outlines how we understand this from a dental perspective, and the food steps in the 40-day program to get our patients, get ourselves, and really kind of plug the science back into, just throw out what we've really thought about eating, unfortunately, in the last 40 to 50 years, and get back to getting our dental health back on track, more or less.
That's so exciting. So, this dental diet that the book you've written, can you share some stories of success of people, patients who've been following this program? What kind of results are people getting?
Yeah, sure. So really, in the dental practice? So I train dentists in nutrition. This is what we really I think we really need this approach in the dental practice, because people going to the dentist for treatment and fillings and braces, and we really need to change that whole paradigm, and it really needs to bring prevention into that factor where we are going to the dentist more often. We're we're getting to the root cause of diseases and stopping them really before they become problems down the track. So patients, so for instance, um, kids that come in with that whole uh, and any pediatrician or any health practitioner that's seeing a lot of kids will report this, and I really encourage you to start looking at them from a craniofacial point of view. Is that when you see these kids when they come in with their mouth open, their tongue hanging out, their um, dark circles under their eye, ask them about their sleep, and nearly always they will have issues with poor sleep, bedwetting. They'll need to sleep on their stomach. Some kids will snore. We've got probably around 5% of kids now. The studies are showing that have obstructive sleep apnea, and this is an absolute disaster. And
Mm,
so we really need to be getting to the root cause. And the problem is, it's multifactorial, but often the raw issue is they're not eating the right foods. And so the
mm-hmm,
first thing we do is we test them with vitamin D.
mm-hmm,
Vitamin D is one of the core principles of Weston A. Price's philosophy, in that we need the body has a core set of nutrients that that it needs to build bones. And so vitamin D, getting a kid's vitamin D, because nearly I mean, the studies say about 75%, but I would say nearly every kid is insufficient in vitamin D today. In if they live in a Western a city,
mm-hmm,
and so once we get them either using cod liver or emu oil, and the great thing about kids is that their levels bounce back, their immune system starts to settle down, so that their mucus is starting to clear in the nose, and we can begin to train them to breathe through their nose again.
mm,
Their adenoids and tonsils begin to settle down, so their immune systems, and then so they can start to breathe right. Well, then we teach them to put their tongue in the right place. They breathe right, and we're removing the harmful foods like sugars, vegetable oils, and flours, and all of a sudden, you know, they they start to change. And so, what the studies are showing is that these kids that are the 10% that have on ADHD medicine actually have underlying sleep issues, and so they're going to school exhausted, and they're acting out
mm-hmm,
in what we would classify as a behavioral disorder. But
mm-hmm.
the core problem is that it's a breathing and craniofacial dysfunction. So once we start to reprogram all of a sudden you see a different kid,
Mm-hmm.
and it's amazing in that kids that are coming off their ADHD medicine because because we're reprogramming the way their breathing and their body is working via their mouth. And so and then the great if we get there early enough, we can get their jaw growing properly, and their teeth start to straighten naturally. And this is it's you I would have said that's a miracle, and it's impossible 10 years ago. But this is where we need to be from a functional dental point of view.
So parents can save so much money and give their child so much health and so much of their future by, instead of going to the orthodontist and paying for expensive, mouth metal to force the teeth into a proper position, the parents could instead focus on these very affordable diet and lifestyle changes that not only will help the body to correct itself, but also on an emotional and mental development level, they'll be better in school, they'll feel better about themselves, they'll have a better immune system, they'll sleep better, they'll have more energy. So again, we focus on healing the teeth and nurturing and nourishing the body to give a healthy appearance of teeth, and that everything else will fall into place. Just like our hair and our skin is a mirror of what's going on inside. If we have um, skin problems, if our hair is thinning or falling out, if we have a lot of cavities, that's all the smoke that's proving that there's something going on inside, because the body is going to take, and this was explained to me once, and it made so much sense. Your body has a limited amount of nutrition if you're eating the standard American diet, or the Western diet.
Exactly.
And so let's say you have half the amount of vitamin C that you need, because people understand what vitamin C is for the most part, and you have half the amount of vitamin C, and your body goes, okay, well, I need to repair the heart, because that is the if we don't have a heart, we die immediately. But I don't need to have healthy hair to survive. And so your body goes in order of, so if you give your body vitamin C, it's going to go in order of most important to least important. For immediate survival, we need the organs, the circulatory system. That stuff needs to be handled first. And then our teeth and our hair and our skin is going to come almost last, because it's not meant for immediate survival. And so if you give your body nutrition, it's not an like an overnight magic pill, because the body's going to take that nutrition and give it to the organs and give it to the primary systems that keep us alive right now. And then when we start to see changes in our hair health, our skin health, and our oral health, that's the sign that we've filled up the nutrient tanks, because that means that, okay, now the heart's been taken care of, the liver's been taken care of, because the body knew to handle those more primary systems first. Does that kind of in alignment with your thinking?
Oh, that philosophy lies in absolute. I think this is exactly how we see disease processes roll out in the body. And actually, the funny thing about and the thing about Price's philosophy is that if you think about exactly, we've got our vital organs, which are the baseline. So what the body needs to do to survive, it's going to push resources to first. But really, so once if you look at how, for instance, the fat soluble vitamins work in the body in this way, where we partition up in across systems, you really see is that dental health and the teeth aligns with bone health. So so what
Mm,
basically holds our skeletal system up, and
mm,
so the way our body manages calcium and minerals is at the bottom of this hierarchy of needs, basically. So if once we get to the point where our dental health and our bones, if we're losing minerals, if our body can't maintain, doesn't have the vitamin system to make sure that we are, building strong teeth and bones, that's a sign that we're in distress. And that's why dental health is such a baseline, um, a baseline kind of
it's
indicator
it's like, sounds
of
like the canary in the coal mine. If you start to see your oral health going down the hill, it's that, oh my gosh, my I might be losing calcium in my bones. I might be, going down this path of osteoporosis.
Exactly, and that's the exact. We all the studies now show. We know. So, for instance, vitamin D, the connection to osteoporosis. But the thing is, we're on a scale, and it's all connected. And the same thing goes to tooth decay. To on the extreme side, we have rickets in kids. But it's at the core process. It's the body managing minerals, and so your body will not. So the resources that it uses, it will not take um, risk your skeletal structure. Because you think about us walking around and hunter gathering and as a biological creature, your skeletal structure is crucial. If you break a bone out in the wild, or you break a tooth, even you're nearly finished. There's no dentist out in the out, out when you've got to fend for yourself, and a dental abscess is nearly going to kill someone straight away. That's more or less why we have such uh, an innervated nerve network to our teeth is because it tells the brain that there's an extreme problem when we have a toothache. And so it's a survival mechanism, is so that we don't get problems with our teeth. And for the most part, any biological creature on the planet does not have any dental disease, whether it's tooth decay or crooked teeth, just doesn't happen. The only time it happens is when we move into civilization and eat the modern westernized diet. Um, and so really this hierarchy of needs comes down to the body needing to manage minerals. And it's one of the most powerful messages of whether you're feeding yourself the right thing or not.
Mm. Now, let's just get into a bit of what the problems are in the teeth so we can kind of understand, like, what is plaque? We keep hearing, brush your teeth, you don't want plaque. What is plaque?
Yeah, sure, it's a great question. And so, I mean, when we look at the mouth, we've kind of seen this whole explosion. I'll just go quickly just to give you some perspective in gut health, right? So we know the gut is has these thousands of millions and trillions of bacteria that manage our digestion, immune system, metabolism, everything, right through to the brain. So we really see the gut as being, the center of managing director of our health, and it's all um, kind of controlled by our gut microbiome. And so this is a huge area in medicine now. We know that we can tweak and treat the gut microbiome in order to fix a host of chronic diseases. But the mouth is our communication to the gut microbiome. And we've really kind of missed this. And you look at the literature, there's a lot less focus on the oral microbiome than there is the gut microbiome. But the mouth, dentists are up to their wrists in the oral microbiome every day, aren't they? And so we're really seeing the first signs, or the upstream part of the river to the gut microbiome in the mouth. And so basically what it means is that we have microbes in our mouth that are managing our dental health. And there's a host of literature now that shows this. We've got 600 species, 600 to 700 species in the oral microbiome. And dental plaque is their mechanism of survival. So they live. So bacteria, the oral microbiome creates plaque to live. Because you imagine the mouth's quite a hard place to live. It's got enzymes and saliva and digestive factors, and the constant chewing and breathing and speaking and whatever else. So bugs actually create plaque to cling to the tooth for dear survival, and these most of the time are actually contributing to our health. So dental plaque in itself is a normal physiological process, and we've learned to scrub it off with brushing and flossing, and that can be helpful in that it stops pathogenic populations pick up. But we really need to see that microbes in the mouth are friendly, and our approach has been very much just to kill anything in the mouth, and that just isn't. It's not the right way to go about it. And we every time you eat, you're eating for trillions of microbes. That includes the mouth. It contributes to your dental health, and then it flows down into the gut.
So when we use mouthwash, Listerine, we're killing the good bacteria along with the bad bacteria in our mouth?
Literally. And the problem with mouthwash is that we don't understand the exact mechanism of how the active ingredients work, especially across. So we've only identified half of the species that live in the mouth. That means we don't know half of them, of any of what even they are. And so the mechanism of mouth, it's like throwing a grenade into your mouth basically, and so we don't know what it does. That's the real. I don't recommend mouthwashes at all, because
Mm.
there is um, there's no understanding of what it does on a microbiome level. We really need to get to this, seeing the mouth through a microbiome perspective, in that we have a whole ecosystem here, and we need to make sure that we're uh, pushing up the health of the entire population, not just cutting out pathogens. And sometimes in disease, we do need to cut out pathogens, because that's the part of the healing process sometimes. But for long-term health, we need to be thinking broad diversity and ecological balance.
So having a little bit of plaque is safe and healthy.
Yeah, like exactly. So the main thing with of course I still tell patients to brush and floss. I still brush and floss, but the main thing is what you eat. If you eat, 3 meals a day that feeding your oral microbiome, stocking your body with plenty of bone building, fat soluble nutrients, chewing well, your body is going to have everything it needs to prevent dental disease. All the systems are within you. That's unquestionable. You've even got an immune system inside each tooth that once you have those nutrients that that manage minerals in the body, that's what protects your uh, your tooth from tooth decay. Is that you have the oral microbiome speaking to the immune system inside your tooth, and that all works in balance. So all the mechanisms are there for you. It's not about wiping out the population.
I love what you just said about each tooth having its own immune system, because I think a big myth that you probably love busting is we've been taught that once we grow a tooth, it's dead. It's just it's there's no you can't repair a tooth. Your body can't reverse a cavity. It's dead, and we have to go to a dentist. They're going to fill that cavity or pull it out, or give you fake teeth or give you dentures or whatever they're going to do. But that, you just have to brush it to take care of it, and use your mouthwash, and um make sure your mouth is sterile and clean, because your body can't heal or repair teeth. How wrong is this myth that we've been taught?
Yeah, exactly. It's very limited. That's the thing, is that we are looking at the extreme level of the last stage of disease when we do that. And so tooth enamel is cellless. It doesn't have its own cells. So once it does break down, the body can't regenerate it, and that's how we see that. But the problem is that the oral microbiome manage the tooth enamel. They actually manage the how calcium goes in and out of the tooth structure via the pH in the mouth.
Hmm.
And calcium actually bacteria exchange calcium and minerals. So they build plaque with calcium from the saliva, and they make sure that your tooth enamel has got enough calcium going in, and they'll actually protect, if you have the right populations there. They'll protect your mouth and your tooth enamel from demineralization. Even when you put a little, say, a rush of sugar, they'll actually push calcium out from their own plaque stores to mineralize the tooth. And so we've got this whole system in place there. And what happens is that tooth decay is when we've pushed it far out of balance, and it's the end stage where the pathogens are overgrowing, all the defensive systems are just absolutely wiped out, and then the body has nothing left, and then the population of bacteria go into the teeth because there's no calcium anywhere else. It's all depleted. We've lost that way of balancing it,
Mm.
and and so it's this balance and very orchestrated uh, symbiosis with bacteria. That's how tooth decay is managed. But as you say, on the other side, that each tooth, we know that, and we're even taught in dental school, the cells called the odontoblasts sit at the dentin. So the dentin is the layer inside the tooth, um, sits under the enamel, and so they sit there with like they're like little SWAT police, and they spit out immune factors, and they'll heal the dentin. So the dentin will always heal itself, because once bacteria and decay goes deeper into the tooth, then you get big problems. And but the dentin are fueled by the fat soluble vitamin, vitamin D, vitamin A, vitamin K2. If we don't have enough of those uh, vitamins, so if someone is vitamin D deficient, their immune cells inside their tooth aren't activating. And so that's why, for instance, I'll see kids, I'll see people, for instance, that haven't, barely pick up a toothbrush, and not many patients floss. I'm going to be very honest with you. With the, I, I've been telling my whole career for people to floss daily, and not many people do it, right? And people just look at you with very glazed over, and they're like, I'm not doing that. But some people will come in and they'll have disease, but then others will not have touched a brush for a week, and everything is fine. It's because we have this system there. And so if you eat the right things, that's the real message here. That's you've got to get your body back into, how it's designed to be.
Mhm. I love it. I love it. I want to definitely get into this diet that you wrote this great book about. I started about 6 years ago taking these multi-mineral supplements in liquid form. It's really great. And I, talk to a lot of other people who take the same brand, very high like high quality and the bioavailable, right? So there have been people who had a cavity and they kept the liquid multi-mineral in their mouth and like sloshed around with it, and they claim to have healed their cavities just with remineralizing their mouth. Have you heard of this, and do you recommend that?
There's a certain level of decay that can be healed. Yeah. So we have the process there. Once a cavity goes far enough, we can stop we can reprogram the dentin to heal itself, but the tooth isn't going to regenerate because we've lost all that bony structure that just can't be rebuilt. Um, so that there are certainly, every time we have toothache, we should be looking to replenish these stores. That should be absolute number one. Sometimes there's going to need to be restoration because we've broken the tooth structure. But the real issue here is that when your body is devoid of these nutrients, there are vast other things going wrong. So your teeth are telling you a message that you need to really start feeding yourself right.
Mm-hmm, absolutely. Now let's just clear up a few other myths around oral hygiene. Um, So fluoride, sodium fluoride, do you recommend people brush with, or what kind of toothpaste or what kind of substances, maybe not even toothpaste, do you best recommend that people use, and what do you think people should avoid?
Yeah, look with fluoride. I don't recommend fluoride, and the reason is that the only reason I don't recommend fluoride is because the problem is that we see it as prevention, and dentists will say it's how you prevent decay. That's not true. We don't need fluoride to prevent decay. It is a treatment. So fluoride may be helpful to in in where disease processes have gone or gone through a certain stage. It may be useful, but it needs to be seen as a treatment. It has its own set of um, co- pros and cons and side effects too. So I don't if we think about food as being the baseline, fluoride toothpaste isn't needed. So with toothpaste, it really is a personal preference, but things like bicarb soda, even coconut oil is great. There's some great prebiotic toothpaste starting to hit the market now, which I'm going to look at closely over. Unfortunately, with the book, we haven't been able to look so close. But prebiotic toothpaste is a really interesting space where they've actually got the factors that prime those great good bacteria. So I think
Mm.
that's an area that I think we're going to be going in.
Mm-hmm.
And there's a few good brands out there, but they're only just starting to pop up. But these factors that actually feed, so putting something in your mouth that actually feeds your teeth, it really is kind of it is more along the lines rather than um, a treatment based kind of rationale.
Mm-hmm. And so I love that you mentioned like coconut oil. Do you see that oil pulling, or when someone puts coconut oil in their mouth for like 5 or 15 minutes while sloshing it around and spits it out? Does that help the microbiome of the mouth?
Yeah, we don't know a lot about what it does to the microbiome, to be honest. But what I mean, I recommend patients eat as much coconut oil as they like, and so that's my kind of message is that
Mhm.
oil pulling is what it's certainly a preference being used in Ayurvedic medicine for a long time. There's certainly rationale in that the damage that we see in the oral microbiome is inflicted by simple carbohydrates. So putting introducing a fat environment does seem to reset this. We don't have any studies on this yet, so oil pulling itself doesn't. We don't know what the clinical outcomes are, but eating coconut oil in your diet is, that's the real message, I think. Yeah.
Hmm. And those all natural toothpastes that have like tea tree oil or have different essential oils in them. Do you recommend people stay away from those because tea tree oil is antimicrobial, or will it not affect the healthy bacteria?
Well, I mean, so things like essential oils, now we're getting into antimicrobials that have a natural, that we get them from nature. So even though we don't know as much what they do, and there are some studies out on the antimicrobial natures, or actions of essential oils like tea tree oil. So these are much safer because there seems to be a natural. Obviously, they've been used, and we've um, you know lived alongside a tea tree plant for many thousands of years. So that is very much on in the safer category. So essential oils are great, and I encourage people to think about it in terms of whether it's a toothpaste, or some people like to do it as a mouthwash. I'm not so big on the mouthwash, but in terms of toothpaste, yeah, I would be looking more across the range of essential oils rather than our conventional set of toothpaste.
Very cool, very cool. So why is it, like, coming back to the children and that you're seeing that they're not breathing right? Like, are they not you said that the if you correct the breathing and how they use their tongue and also
Mhm.
nutrition, those three things combined, then the jaw can grow healthfully and the teeth begin to correct themselves in terms of alignment.
Mm.
Why were they not using their tongue correctly? Why were they not breathing correctly? Was that also related to nutrition?
Yeah, so I mean, it really goes back to, and we're even seeing. So, for instance, there's a pediatric dentist in Chicago looking at ancestral newborn skulls, and how our babies are being born with the jaws set back in the mouth. So, and the functional aspect of jaw growth really begins with breastfeeding. So a child
Mhm.
needs to push a mother's nipple to the roof of the mouth. Their palate is soft like wax, and so that force pushing that tongue up, and that nipple against the palate, and then swallowing, and the peristaltic wave, the tongue motion, swallowing motion that the child learns to do, um, expands the upper jaw, the maxilla, the palate. And so when you look straight at any health practitioner can do is look into a kid's mouth, look at their palate, and palates should be flat and wide. And nearly invariably, we will see kids with high arch, thin V-shaped palates, and that's a sign that we haven't had this development. Breastfeeding kicks all of this off, but what it does is it starts to show that there's a functional aspect to jaw growth. And so, if, for instance, if we don't feed kids a hard enough diet, moving on from breastfeeding, then the same principles occur. The jaw doesn't get these growth factors, and so what happens is that we begin our skeletal structure at some point doesn't um, doesn't hit a growth factor, or we get an obstruction. For instance, if we have mucus or allergies, or swollen adenoids and tonsils, then we have obstruction to nasal breathing. And so the first thing that happens is that a kid, mouth breathing is a survival mechanism. And so when a kid can't breathe through the nose, they'll breathe through the mouth. And mouth breathing itself will cause elongation of um, the jawbone, so that improper growth will occur because we're mouth breathing, and then it becomes a flow on. Then the tongue, to mouth breathe, our tongue must sit low in the mouth, and but where it should be is up against the palate all the time, except when we're opening to speak, or and eating, for instance. And so if a kid doesn't have this oral posture, their jaws aren't getting these messages, and and everything begins to become disjointed. And so basically, crooked teeth are like it's the end stage, the epigenetic end stage of functional and nutritional input. So it's in every moment of every day we are influencing our jaw growth, whether it's tongue posture, whether it's breathing, whether it's the nutrients that our body is using to build these strong bones and teeth. And so that's what it becomes a flow on effect. So once a kid is mouth breathing, their tongue posture is low. This that in effect stops that whole process, and the upper jaw becomes thin, and the palate is high. So a high palate impinges on the nasal airway. So a kid with crooked upper teeth has a very small nasal airway. They'll struggle to breathe through their nose, and this can contribute to things like deviated septum, and then so all of these small flow-on effects that happen earlier in life, creates a 5, 6, 7-year, 8-year-old that can't breathe through the nose, and they don't get those developmental signals. So it's all about recorrecting the whole craniofacial growth cycle.
That is fascinating. And at what age is it too late, or can adults do something, like, even
Adults
if
can still do it. Yep.
really?
Yeah, we can. We know that, and there's a whole new field of adult expansive orthodontic where we can. We used to think that the palate was fused. Um, once we get once we reach adulthood, but any as long as there's pressure, as long as there's messages, stem cells will form across the middle of the palate, which is your maxilla. So the upper jawbone is two bones fused together. Well, not fused, but what happens is that there is a symphysis there that if you put the right forces, it will build stem cells and it will build bone. So we can expand the palate in adults, and so a lot of sleep issues, a lot of breathing, a lot of postural issues can be rectified. And so if you do scans on the facial change that happen, is that we get complete uh, jaw growth shifts. So the expanding the palate, for instance, will make the body remodel the lower jaw, and also the maxilla. The eyes will change. So sometimes people's eyes will level back because our orbits have um, basically got where they should be epigenetically. But the amazing thing is the sphenoid bone, which sits behind and is, it's a brain, it's the case of the brain, will also remodel as well. So we're reshaping the entire skull. We can do this. And in kids, it's crucial because this is obviously where it all happens. But if we had crooked teeth or braces, we're walking around in a skeletal system that is unfortunately maladjusted.
Mm-hmm. What about wisdom teeth? We're kind of taught that we should all just have our wisdom teeth removed. What's up with this? Is can we, if we have a healthy jaw, because of everything you just mentioned, there should there be enough room for the wisdom teeth? Because it just doesn't seem natural that we've been here for, let's say, 2 million years or whatever, and all of a sudden now we can't survive unless we have our wisdom teeth removed. It seems odd that, how we've been created, whether you believe in God or you believe in evolution, however we've been created, it's like you're perfect and whole and complete, except we got to remove those teeth that are in the back of your mouth because you can't live with them.
Exactly. That you couldn't put it any better. Actually, it is. There's something like 10 million wisdom teeth removed, or more even actually in the US, and we just don't question it, do we? And the problem is that it's this the when kids that need braces are facing the same problem with jaw growth as the adolescents that then get their wisdom teeth removed. We don't have those. The jaw continues to grow. It grows in thickness with appositional growth. It grows transversely. It grows in 3 dimensions as we go through adolescence. And it's quite subtle, but that growth um, uh, period, that's what creates the space for wisdom teeth. And we're basically a species that cannot fit the teeth it's designed to, that we've designed. were designed to fit into our craniofacial structure. And so wisdom teeth are a sign that it's the same thing. And it's the same problem as crooked teeth earlier in life. And so, unfortunately, we sometimes do need to remove them because the jaw growth, you can't, it's very difficult to grow the jaw to correct that. But what we need to be thinking about is getting to the problem much, much earlier.
Mm-hmm. Well, I'm glad my listeners are learning from you so that we can get to the problem. Especially for their children. But like you said, there's hope for adults because we can do something to correct this. And the biggest issue is the internal health, right? Because we can have a really pretty smile, but if all of our organs are failing from malnutrition, then it doesn't matter. So we want to
Exactly.
make sure that we have that wonderful internal health. Let's talk about your book, The Dental Diet. What are some do's and don'ts in our diet that we really should pay attention to?
Yeah. So the dental diet is about building principles so that we eat health foods that create strong teeth and a great smile. But that's really what creates a strong body as well. So the number one thing with the first thing to figure is that the number one nutrient that we see with our teeth that our body needs is oxygen. And so breathing is the first way that we should be feeding ourselves. And so nasal breathing, reprogramming ourselves to breathe properly is one of the big steps to nourishing our body properly. But then, so the next step is that we need to get those crucial bone growing factors. And so, nearly every meal we should be looking to get to make sure we're eating foods rich in the fat soluble vitamins. So, vitamin A, vitamin D, vitamin K2 come from a very specific set of foods that build that. If we don't think about them, you don't get them. And so it's things like grass-raised butter, cheese. We've kind of cut these things out of our diet. Organ meats. Most are from animal products because the active form of fat-soluble vitamins come from animal products. So I think eggs. So getting enough of these foods and making sure one portion of your meal is supplying that is crucial because that's more or less what our body is looking for when we're eating. And traditional societies have really focused on that. They've really made sure they get foods that that have these nutrients in them. And then the next factor is that we need to be thinking about the microbiome because we're eating for trillions and trillions of our friends, our bacteria, and that we need to eat plenty of vegetables and foods and rich in fiber because that's what they feed on. That's what they use to do all the signaling processes in the body. Prebiotic vegetables, which are specifically fermented to short chain fatty acids, which is great for the gut and also great for gum health as well. And probiotic foods, so fermented foods where we're replenishing the actual populations of bugs that are protecting your mouth and your gut. So these really, it's if you eat in this way, your body is healing itself. So we learn these principles and look at the foods and the cooking principles that help us to kind of eat this way in the modern day. And kind of last, it's really epigenetics really is our sourcing of talks about how sourcing of food is important. So we do need to consider where it comes from, and unfortunately, the life of our what we put on our plate will eventually be translated to our genes, and so that's we need to consider that well-sourced food you know has a rich nutrient background because it lived a life that was nourishing itself, and that's what nourishes us as well.
I love what you just said. The life of what we put on our plate will essentially feed our genes, right? So we have to keep thinking we've got those 30, however, 37 trillion cells, however many cells we have in the body. And we need to consider that we're feeding each and every single cell. And we have to think about the nutrition coming in and the waste coming out and optimize that process so we
Yep.
can fully nutrify our body on that cellular level. And I love that you mention, really making sure that we're supporting, like you said, the biome of the mouth, because that is related to the biome of the gut, and we don't fully know the en- the entire role that this biome has, that this biome, plays in our health. But it's so new, that it's such a new science, but it's so important that we do take care of it. We can't create a sterile environment. Look what happens when we take antibiotics and we kill off the good flora. Then in comes all the bad flora. And so we can see that, in our gut. So it must also happen in our mouth, that if we just kill off all the good bacteria in our mouth, it leaves our mouth defenseless to the bad bacteria that can come in. Is that correct?
Absolutely, that's exactly right. And even on that level, in terms of using mouthwashes, for instance, yeah, this is exactly what we need to be thinking about. We need to replenish the stores because these bugs are doing critical physiological processes.
Amazing. Now, you mentioned that sugar, vegetable oil, and flour are something that we should absolutely avoid in our diet. I think that really hits the nail on the head. And when we eliminate sugar, vegetable oils, and flour, we're really left with a whole foods diet. Lots of vegetables to choose from, lots of
Right?
healthy fruits, healthy dairy products if your body can handle it, and grass fed, free range organic meat. I like that you pointed out organ meats. I think that is something that we turned away from, in at least I know in Canada and the United States. We turned away from them back around, after World War II. Those cuts were more used before then, and then they became all of a sudden the poor person's meal. And so it became more of a stigma that we should, if you can afford the better cuts, like the steaks, for example, then it was a status symbol, right? And so we kind of moved away from it. And after a few generations, now people are kind of grossed out by organ meats because they weren't raised on them. So
Exactly.
we need to think that it's about nourishing the body, and there's lots of healthy nutrients in those organ meats. Any advice for someone who's like totally grossed out by thinking about a kidney pie, or liver and onions? How could we start to,
Mhm.
do you have a recipe that you do you recommend?
Yeah, so that's exactly part of it. So recipes are important. Pates, sometimes people like pate, so um, either chicken or duck liver pates. Sometimes because you can put lots of spices and mix it in different ways. But one way is the mix meatballs. So you make
Mm.
meatballs with regular meat, and you put about quarter. So you cut up a slice of depending on how many you're making, one or two slices of grass-raised liver, from say beef or lamb or whatever. Duck's great too, and you just mix it and you don't taste it. And so you put it in a bolognese, you put it in a nice sauce that you've made, and you're getting those nutrients, but you're not tasting it. Yeah. So that's
That's
yeah.
cool. I like that you said that, because what I noticed at my store is I go to like a local co-op that has a lot of local grass-fed organic meats, and they have this grocery store has a relationship with all the local farmers, and they only buy humanely raised and treated animals. So it's very it just is a feel good kind of grocery store. But what I noticed is that organic meat, of course, is always going to be more expensive. Grass fed or organic is more expensive. But then I looked at all the organ meats that are grass fed organic, and they were not more expensive. They were less expensive. And
Yeah.
so I was like, wow, I could really, not only am I eating something full of nutrients that my body needs, like making that, like making a meatloaf, or like hiding it, right? Making a meatloaf, or making meatballs. um, you're actually almost using this more nutrient dense food as a filler, because it's going to make it less expensive than if you just bought a bunch of grass fed organic meat. So including those organ meats can actually extend your food budget.
It's a great point because eating. We kind of see that unfortunately eating has become we eat the cheapest foods kind of available, and we see that we know that that eating naturally raised uh, you know from grass raised animals and and organically raised plants, that it's more expensive, and it makes the farming process is more in depth. So it's actually one of those great paradoxes that exists, is that when we're, instead of sending um, so spending more money on these more nutritious foods, we can actually save. So that's one of the great points. Yeah.
Very cool. Yeah, absolutely. I noticed that when I cut out my family cut out grains and sugar from our diet, um we actually did save a lot more money because packaged foods is not does not, even though we think it might save us money, but eating lots of vegetables can fill you up, and eating lots
Exactly.
of yeah, just, general healthy meals, and also balancing your blood sugar. One of the naturopathic physicians I've spoken with and studied with, he says that there's a real direct relationship between sleep apnea and blood sugar imbalance. And so those who are eating a
Yes.
high sugar diet end up causing sleep apnea because their body is going into that hypoglycemic state. Have you observed that? Is that in your opinion one of the causes of sleep apnea?
I think it's certainly related. It is all in that under that this pyramid of dysfunction. Sleep apnea is very much it. There's a lot of great literature now next to vitamin D, which when we eat a high sugar diet, most people do end up in the range of vitamin D deficiency. So I think it's on that sugar reduction is one of the first things that we take patients through. That's yeah, and unfortunately when we see this blood sugar dysregulation, it's a hormonal issue that changes the diurnal and sleep cycles. So yeah, so it's all related. And when you fix these um, underlying processes, it all begins to settle in, and people sleep better, they breathe better, and they're generally much more healthy.
Now, why do people grind their teeth? More and more people I know get mouth guards. What's up with grinding of teeth?
Yeah, it's it's a breathing issue. So teeth grinding is very common in people that what's actually happening is that you're going to sleep, and that your brain is moving your jaw forward to open your airway. So that's why people will generally grind their teeth, and it is stress related. We kind of say, oh, it's due to stress, but there's people that live high stress um, lives do seem to be more do more clenching. But the core issue is breathing. And so what it does show us is that there's a whole epidemic of sleep uh, breathing issues that aren't diagnosed as sleep apnea. And the condition is called upper airway resistance syndrome. It's not a medically recognized term yet, but nearly anyone that can't grow 32 teeth has some level of it. And what it means is that when you breathe, your airways have pressure sensors, and so when the brain senses a certain amount of pressure, it's going to think whether your airway is going to be blocked, and that's a survival mechanism. So when you sleep, when your muscles relax and there is a raise in pressure in your airways, the brain uh, is alerted to this choking response. So we're basically people that can't maintain their airways when they sleep, they go into these very silent choking responses. And so what that will actually do is trigger them to push their jaw forward and open and grind their teeth. And so it's a less severe form of sleep apnea, but it has a flow-on effect to the whole body. It pushes into sympathetic um, distress, so people are basically in flight or fight mode. Um, and it links to digestive issues, depression, anxiety, cold hands and feet, and a host of issues because we have this autonomic system imbalance.
I like that you said that autonomic imbalance, autonomic system imbalance, because the parasympathetic system, we have to do so much to make sure that we are in balance, both like through active relaxation, stress management, because and then also nutritionally making sure that we're not causing that stress on the body. We need to make sure that we bring ourselves back into that balance, and things like grinding teeth or that smoke that we need to say, hey, wait a second, this is a symptom of something deeper, and not just get a mouth guard for it. Like, oh, I have crooked teeth, not just get braces for it. These are issues that we're cosmetically changing without realizing that they're symptoms of a root issue. And we really, really want to listen to those symptoms and make that correction because it's about our internal health. Is this the cause of teeth grinding? Is it related to the cause of snoring?
Yeah, it's the same. It's the same syndrome. So snoring is where the muscles relax, and that you get a vibration in the airway. So what happens in teeth grinding is more related to it's so it's kind of this whole paradigm of sleep disorders. And so teeth grinding, does occur in snoring and sleep apnea, but it often occurs in people that don't snore, that are having these airway episodes, but very silently. And so what they do is they grind their teeth. But it is the same phenomenon in that the airways can't support themselves when we relax and go to sleep. And we also don't have the the tongue actually holds the airways open through the day. And so when you have the right tongue posture, you strengthen and you open up the pharynx. And if you don't program and you don't strengthen these muscles, so kids that don't have the right tongue posture and that go to adults, then we don't have this strength to open our airways at night.
Do you cover this in your book, The Dental Diet?
We do. So it's the basis. So we cover the skeletal basis of airway issue and why crooked teeth and wisdom teeth problems have basically pushed us into a breathing epidemic. Sleep apnea is one, but then we've got this host of people with upper airway resistance syndrome and kids that aren't breathing right. And it's because their skeletal system isn't working right. So it's about reframing and understanding that this problem that we have with our teeth not growing is fundamental to everything.
Well, I know people who have gone for surgeries for snoring.
Mm.
And so if they're willing to go to that extent to go under the knife because they snore, and it didn't, by the way, did not heal their snoring. They still snored like a train was going through the room. Um, I know people would be interested in your book, just to solve snoring as a problem. So is this something that they could, by following the principles that they learn in your book, that they could reverse their snoring?
The dietary principle, we need to get to those because the dysfunction that's happening in the body is underlined by not eating the right food. So we need to get the dietary issues um, back on track as a fundamental point. And then from there, snoring, we can. The great thing about snoring is that if we get a good diagnosis, we can. So, for instance, retrain nasal breathing. My functional therapy now can retrain adults to reprogram their tongue strength and their posture and their oral posture so that they breathe better at night. So if we breathe right through the day, we can breathe better at night. And there's ways that we can train nasal breathing at night so that we're getting that healthy breathing and oxygen delivery. So it's it's certainly all based in the foundations of what we feed ourselves though.
I love it because yeah, we have to come back to there's our body is functioning as a bunch of cells. And so we have to keep remembering that if we want to change something, if we want to change a symptom we don't like, we have to come back to taking care of every single cell in our body, and our body is this amazing machine that can self-correct.
Exactly. I love the way that we put that, and the body is fantastically adept to adjusting to different situations. We put it through such duress, but you start doing some of the right things that are right on point to what it wants, and it will respond. It's quite amazing how strongly programmed it's within us.
Mhm. Now you talked about adenoids in children, and if a child has a stuffed up nose. Um it's common knowledge in the naturopathic field that dairy consumption in children is the number one cause of ear infections, and sore throats and stuffy noses, and that by taking a child off of dairy more times than not, they can avoid having those tubes, that surgery where they put tubes in the ears and they take out the adenoids. Um, is that something that you prescribe to or that you recommend that parents look into if a child is also stuffed up and has, sore throats and ear infections, that they look at avoiding dairy?
Yeah, I try. I mean, some kids need. We do have gut issues now that where dairy is a problem and that it causes that. We've got that gut permeability that causes the food intolerances. I recommend, and we also do this within the dental practice, is that food intolerance testing, so that we know there's usually a set of foods, especially that we're having an IgG response to. So dairy is common, but there's sometimes a set of foods that kids are having responses to. So I try and, I mean, the thing about dairy is that like good dairy, there's a big difference between what we get off the supermarket and good dairy. So I've seen great. Sometimes kids need to go off dairy, and so that's what seeing naturopath really helps us along the line with, is that we can get to the the actual foods that are causing the mucus reaction. We heal them, and then a lot of the time, many a time, kids can eat dairy fine. Butter,
Mhm.
and they, because we've healed the gut then, because they're
Mhm.
and some kids, for instance, are lactose intolerant, so they can't have milk, but they can have butter and they can have some cheeses because there's no lactose in it. So it's not a straight yes or no. There's a
Mhm.
lot of benefits, I think, to dairy, and especially if you get the right dairy. But some people do need to avoid it. Yes.
Mhm. Wonderful. Are there any other myths that we really should bring to the table and bust here today in this interview that we haven't already?
Yes, I would say bleeding gums is
Ah,
uh,
I forgot to cover that one.
yeah. So it's like, we talked about the gut microbiome, but bleeding gums really is the sign that, I think it's one of the first signs of intestinal permeability, and so it's the first sign that your immune system isn't happy with what's going on in the in the gut. And what's happening is that you've got the bacteria, the microbe, and immune relationship in the mouth beginning to play up. And so that progresses if we leave it to gum disease. And gum disease is where the body basically eats away the structures that that hold the tooth together. And I should have a blog up in the next month or two on the paradigm that gum disease is an autoimmune condition, because it's basically the body being programmed to eat its own cells. And so bleeding gums, I think, really are one of the first signs that we've got gut problems. And so instead of just scrubbing away, and yes, some flossing and brushing will help, we should really be looking at healing our entire gut, and looking at our diet, and thinking about what's causing that inflammation, and really, getting to that, putting that fire out before it becomes a problem down the track.
That's very interesting. I was under the impression that bleeding gums was just a scurvy, that really we needed to up the vitamins, up the vitamin C, because it was the body's inability to maintain healthy vascular function.
Well, no, there's certainly a level of nutrient, um, function to it, but I mean, it's more or less the immune system losing that tolerogenic interface with the microbiome. And
Mm-hmm.
so, the mouth is this interface. The gut is, the primary interface. And so it's a message from the gut that, and vitamin C and immune supporting factors are going to help that, because it's going to help prime a stronger immune system. So it all plays a role, yes.
Is
But
that the same as receding gums?
receding gums can, so in gum disease, the gums will start to recede, so it's the latest stage. You can also traumatically recede gums by oral hygiene practices. Um, but so gum disease is on the side of the spectrum to bleeding gums. So if we let bleeding gums continue on for years, then it begins to the gums recede, and that's when the tooth begins to be exposed, unfortunately.
Now, I heard once that receding gums was the jawbone getting smaller and losing its structure because of mineral depletion. Is that, I mean, is that an accurate statement, or is it more like what you said? It's a progression of the eating the wrong foods, not enough nutrition, and
It's
not taking care of the mouth biome.
Yeah, exactly. So it starts with that immune dysregulation, and what happens is it's a progression, and so eventually you build antibodies basically to your own gum, the collagen in the gums that breaks that down, the gums shed away, then the bone's exposed, and then what happens is the bone is eaten away. So it's both the body not being able to manage um, the bone growth and its factors, but there's an immune response. So the body's eating itself away. It's like an autoimmune condition.
Mm-hmm. Yeah, it's really interesting. I think autoimmune conditions are still so misunderstood. And,
Yeah,
you know,
yeah,
talking to
absolutely.
so many doctors and so many patients, it takes an average of a patient to see 5 different doctors before they're accurately diagnosed with an autoimmune condition. And Dr. Joel Wallach, who's one of my favorite naturopaths, he's one of the oldest and still practicing naturopathic physicians, says that everyone has it wrong, that autoimmune condition is not the body attacking itself. It's that the body is the immune system is eating away and cleaning up the inflamed tissue. But if we have inflamed tissue for so long, that it just keeps doing it. And so and like you said, you know, you clean up that diet, we're gonna put out the fire, we're gonna put out the inflammation.
Yeah,
And
that's a great way to put it. Actually, yeah, I hadn't heard that, but it makes a lot of sense, because it's an inflammation problem. That's the
mhm,
thing. It becomes illogical inflammation, more or less, and that's the
right.
baseline problem, right?
Yeah, because I think a lot of people, when they hear autoimmune condition, they start feeling like their body isn't a body is the body is stupid because it's
Yeah,
attacking
yeah,
itself. The body is stupid, and I need drugs to control my body because my body's too stupid, and I can't heal. And my body's attacking me. It's my enemy, and it's against me. And that's the attitude that people start to have when it's the opposite. The body's so intelligent, but it's the stupid diet we've been eating that the body's trying to clean up our wrongdoing, and we need to clean up our diet so our body can function healthfully, and our body's the immune system's doing the best it can to clean up all the garbage trash, and fire, basically, that we're causing, this inflammation that we're causing from our environment, from the food we're eating, you know, unknowingly, right? We didn't know, we didn't realize that eating this Western diet was so destructive, and now we're finally coming back to seeing it. So I love the message you're sharing. I think it's so valuable, and I can't even imagine how many thousands upon thousands of lives you're going to help when they begin to look at their oral health as something that directly reflects their longevity, their vitality, their emotional and mental health, and their physical health as well.
Oh, thank you very much. It's been a very rewarding kind of path for me, but and it's been a lot of learning. But I'm really excited. I think we're on the verge of kind of getting back to understanding our health. So, all the messages that you're getting out, which is really helping so many people. We're really coming to a coalescence of getting back to understanding what our bodies need, and how we can really escape these really burdensome diseases that people are unfortunately living with.
Absolutely. Now, I definitely want listeners to check out your website. It's full of great information. Like you said, you're going to be coming out with that new blog post soon. So I have, it's drstephenlin.com. That's Lin. And of course, the link to everything that Dr. Stephen Lin does is going to be in the show notes of today's podcast at learntoyourhealth.com. Um, Walk us through your website. What do you definitely want people to check out? I know you've got this wonderful free guide, Mom's Guide to Straighter, Stronger, Whiter Teeth for your kids and your whole family. If they put their email address in, you give them that free guide. I think that's really cool. What else should they know about you? Can someone do a consultation with you? You said that you train dentists. Do you also work with individuals around the world through Skype, or do people have to see you in person, or should they all just start by buying your book? What should we know and what should we look for on your website?
Yeah, so the book, The Dental Diet, will be out in January 9th, so it's available for pre-order now on Amazon. But also alongside, we're just recording a program now, the Healthy Mouth, Healthy Body program, that is going to be an online program to help people really reboot their oral health and get back to using these raw principles, the what supplements they need, what functional issues they need. How do we find a functional dental practitioner? And so this should be up in October or November on the website, and they can do the program alongside the 40-day meal meal plan in the dental diet to really kind of kickstart. And it's all done from home. Everyone's kind of needs to be their own dentist. So every meal, every breath of every day. So it's about reprogramming and really getting your families and your own life on track so that you're not going down towards expensive dental treatment and other sicknesses down the road.
I love it. I love that you can save us so much money. And I bet there's a lot of dentists cursing you right now. Curse you. I'm not going to make the $10,000 from that expensive dental surgery, or, those receding gum surgery, which is such an injustice to the patient. Really, I love the type of dentistry that you're practicing because you become more of their holistic, whole self doctor, where you're looking at the person and you're going, okay, um, we're gonna take you on this journey of whole health, and we're using the mouth as the gauge, which is so wonderful. I wish there were all dentists were like you. I wish all eye doctors were like you. I wish if I went to an eye doctor, he said, okay, before we give you glasses, let's do these exercises and take these supplements and take this stuff out of your diet, because so many people have inflammation and it affects their eyesight. And the doctor just says, okay, here's a drug, here's your eye drops, here's a set of glasses, but they don't actually train the person on how to get to the root cause. So many doctors could be more like you. So I applaud you. I applaud the work you do. I'm very excited that you're also training doctors. Now, if a doctor's listening and they're interested in learning more from you, do you have a program or do you have a mentorship program? How does that work?
Yeah, so it's a nutrition in the dental practice program, but it's also extended to uh, practitioners, allied health practitioners, where we can start to learn oral health and how we start to bring that into a practice. Because the mouth shouldn't be a segmented part of the body; it's all part of this this healthcare paradigm where we can fix people functionally.
Wonderful. Excellent. It's been fantastic having you on the show, Dr. Stephen Lin. And please come back on the show, share more after you've successfully launched your book and your program. I'd love for you to come back and share some stories of success with us and any more information as you continue to dive into this, how to support us on a holistic level, and especially when you learn more about the biome as all this information unfolds. I'd love to have you back on the show.
Oh, absolutely, it'd be my pleasure, Ashley. Yeah, I've really enjoyed it, and I'm really looking forward to this conversation. Where we're just learning so much more about the body.
Wonderful. Thank you.
Thanks, Ashley.
Enjoy what you heard today on your episode of the Learn True Health podcast. Did something move you, inspire you? Did you get great information that's going to change your life? Awesome. That's exactly what I'm here to do, is to help you gain your health back. Please turn around and share this. If this is something that's helped you in any way, share this with those you love. Love the Learn True Health podcast and want to support us? Awesome. You can go to takeyoursupplements.com and you can support us that way. You'll get access to amazing supplements that are just really great quality for a great price. And there'll be someone on the other end of the line to help you pick out your supplements that are right for you. That's takeyoursupplements.com. Or join our membership, learntruehealth.com/join. That's another great way to support our podcast, support our movement, and you'll be supporting yourself. Gain more information, wonderful videos, wonderful trainings, and you'll also be able to share those with those you love as well. So go to learntruehealth.com/join. Want something fun for free? Go to learntruehealth.com, and right there on the front page, you'll see where you can get our free cookbook. I spent a lot of time making it, and it was so much fun. It's really delicious, healthy recipes. And you can also get our 7-day doctor course. Right there, it's 7 days of naturopathic videos sent right to your inbox, and you can learn from top naturopaths on how to gain health naturally. So that's takeyoursupplements.com for wonderful supplements. learntruehealth.com/join to join our awesome membership, which is only open for a limited time. You can get our free healthy cookbook, and you can also get for free 7 days of wonderful naturopathic videos sent to you. Just go to learntruehealth.com and you'll see it right there on the front page. Thank you so much for being a listener, and thank you for sharing and helping others. Let's spread this information and turn this ripple into a tidal wave.